Hello, team. I just wanted to go over the different parts of the periodontal chart. I think that some people may know more than others about what all of these things mean. And while we're working with you, whether it's charting with a patient or it's filing your insurance claim, I think it is important to know what each of these aspects of the periodontal chart actually mean. So I wanted to go through this with y'all. And I populated my periodontal chart. These are not my real numbers, thank goodness, but these are the measurements that you would take. So what we typically start out with is the periodontal probing depth. That is the measurement of the periodontal pocket. A periodontal pocket is represented in this picture on your left side of the screen. So if you look at this, the periodontal probe over here is measuring an area where there is gum loss next to the tooth. So if you're looking at this, you can see the crown of the tooth, you can see the root of the tooth, and the root is what actually sits inside of that jawbone. When there is bone loss or there is inflammation over here, the periodontal probing depth, which you can see with this metal probe, is what increases in infection or disease state. So these numbers are represented on this periodontal chart as probing depth. A healthy number is 3 or less. You can see some of these numbers that are greater than 3 are highlighted in red. Those mean that they are not healthy pockets. Sometimes you can have a 4 millimeter pocket that is okay and healthy enough, but I wanted you to know the probing depth is when we actually measure the spots around the tooth. Each tooth gets 6 measurements, 3 on the outside surface and 3 on the inside surface. That is the periodontal charting that we chart first. It is found over here in the periodontal probing depth section. If your charts don't look like this, especially if you're a new employee, you need to change them so that they are in this order: probing depth, then bleeding, then gingival margin, attached gingiva, suppuration, furcation. The area you would change those periodontal probing notations can be found right here. So you can see that you can change and rearrange them and put them in different positions. So this little toggle right here is how you actually change and put these periodontal probing depths and everything in the right order. The other thing you'll want to change is to make sure that bleeding is set to 0 to 4 and attached gingiva is set to this 0 to 5 number. Okay, so when you go along and you're periodontal probing, Macpractice does have an error in the software. So you have to make sure, do you see how this box is flashing? That the box is actually flashing before you start typing. Sometimes the first 3 numbers can go awry, and that is a software issue that Macpractice has. But if I were to call out 5, 5, 5, and you can see that this goes along the chart in the numbers and in the order we need to go. So it should go on the buccal surface, which is the outside surface of the tooth. So that is found right here on the maxillary arch, and the buccal or outside surface is found right here on the mandibular arch. This line and this group of lines are the inside or towards the tongue side of the mouth. Okay, so the periodontal probing depths, we're going to start over here on the upper right and go all the way across. That's from 1 to 16. Then what we do typically is wrap around, which goes from the inside on the top arch, number 16, all the way back to tooth number 1. Then we skip down here and go on the buccal surface or outside surface of tooth number 17, if it's present, or 18 in this example over here. We go all the way to number 32, then wrap around and go back to 17. This is pretty universal charting pattern that most periodontists perform. Everybody that graduates from UAB charts in this order. Another way, if your charting numbers are not probing in this direction, or there's an error and it jumps around on the periodontal charting, check this little wheel over here to change your settings. You can see right here that there are input orders 1 to 16, and then 16 to 1. 17 to 32, 32 to 17. When they make your new user login, it should be in this order, but if it is not, make sure to change it so that you chart 1 to 16, then 16 to 1, then 17 to 32, then 32 to 17. There are other things that you can change on your periodontal charting as well. You can show the teeth, which takes up a lot of the digital space. So I usually don't show the teeth. I hide the teeth so I can see more numbers at one time and help show a patient this information. The other thing that we're going to take a look at are the periodontal. So after we get done probing, the next thing the doctors are going to do is tell you which areas just bled from bleeding on probing. When you have a pocket that is inflamed and you poke it, it should bleed if there is disease. So that is what we're measuring. It tells us a bunch of different information. You can have a healthy pocket or a healthy bone levels, I should say, that still bleed. And that's important information too. Those are denoted right here in bleeding as zeros and ones. So we will then, once we get done charting our periodontal pocket depths, 1 to 16, 16 to 1, 18 to 32, 32 to 18, we are going to go right back where we started and start with bleeding on probing. These are measured in zeros and ones, so you will hear us call out 0, 0, 0, 0, 0, 1, 1, 1, 1, 1, 0, 1, 1, 0, 0, all the way across over here. Following the same pattern, wrap around 16 to 1 on the lingual side over here. Then we're going to go 18 on the bottom in the bleeding on probing, and then 32 to 17. Without even, if you're not clicking around on the periodontal charting, it will automatically go in that order. The next thing we are going to measure is the gingival margin. A gingival margin is the actual recession. So sometimes we have patients who have gum disease and we're measuring their gum disease, like periodontal disease or pyorrhea, just traditional perio disease. We use the periodontal pocket for that, or the probing depth. Sometimes our patients are referred for recession. Recession is denoted by gingival margin. So when you are looking at this periodontal chart, gingival margin is the actual recession that exists on a tooth. I do want to show you an example of a case, so that will make a little bit more sense. And I will open that up. Give me 1 second. I didn't even think about doing that until now. Let's go to lectures over here. I have a good example of periodontal recession. Oh, there's Dr. White. Say hi to Dr. White. Okay, so let's talk a little bit about this actual gingival margin and what does gingival margin actually mean? So gingival margin is the measurement of recession on a tooth. So if you were to look at a case like this right here, this is a good example. This patient, you can see in the front, has some recession on these lower two front teeth. So these lower two front teeth, we would actually chart, if I were to chart gingival margin, 0, 0, 0, 0, 0, 0, 0, 0, 0, 0, 3, 1, 1, 2, 1. So when we're measuring the actual recession, we're measuring this area of exposed root surface. That is the gingival margin on the periodontal charting, okay? So when you're looking at that line or you're filling this form out for insurance purposes, gingival margin is the area of recession. The next number the insurance company as well as the doctors are using for their diagnosis is this topic called, or this section called attached gingiva. That is the amount of gum tissue that is bound down in an area. So again, when you're looking at a area of recession like this, let me see if I can hide this, this line really quick. What we're looking at is an area of attached gingiva. So you can actually see there's a difference in the quality of the tissue right here versus the quality of the tissue right here. There is attached gingiva right here. That's attached gum tissue that is keratinized like the tissue on the outside of your skin. And in this area on 24 and 25, there is not any attached gingiva. That is why it's important to note this type of gum grafted area, I would choose to do a certain gum graft, and the insurance company would choose to reimburse it if it doesn't have any attached gingiva. Or sometimes they require some to do like cadaver tissue grafting. So this is why I outlined in this presentation this white line to show you where the attached gingiva actually lies. So if we take that information back to the periodontal charting, you will see over here, like in the 24 and 25 area, we can say that this patient had like 2, 3, 1 millimeters of recession, 2 millimeters, 3 millimeters, 1 millimeter, and then 0, 2, and then 0. So that area of gingival margin is the measurement of the recession, and the attached gingiva you can see is 0 millimeters in this area. This is not an exact representation of that picture. I just wanted to show you the example. So when you're submitting this information for insurance, they need to have 3 or 4 millimeters of recession, which means the gingival margin needs to be 4 millimeters or more for them to reimburse. They also want to see 0 attached gingiva in at least one of the 3 spots on the tooth surface. They don't all have to be 4 millimeters for recession or gingival margin. They don't all have to be 0 millimeters for attached gingiva, but they do need to have one spot on that tooth that actually shows it for them to reimburse without a whole lot of questions, okay? So those are some of the main areas that we will be probing. Other things that you will find on the periodontal chart, you see these green dots over here, these are suppuration. These are areas that when you're probing inside of this pocket, and we're poking right there in that pocket, pus comes out of the pocket. It is very important to note which tooth actually has suppuration or pus coming out of the pocket, and that is denoted by this green. You can select it two ways while you're probing, okay? You can actually say, oh, okay, I saw on the mesial buccal of number 8, suppuration. At the end of your probing, you can mark it by clicking on that tooth. If while you were probing, you see it, and I was doing the initial probing depth, say, let's see, I'm going over here and I measured a 3. I measured a 3, and I measured another 3. And there was suppuration on this 3 right here, the mesial buccal of number 8. You can actually just hit the S button, and S will give you that same suppuration. If I saw it again on this tooth number 9, and I measured, let's see, I measured a 7 on the mesial buccal of number 9, and I also saw suppuration at this site, you just have to hit the S button, and it will continue with your periodontal charting without interrupting the periodontal probing depths. So it will always choose the previous tooth suppuration site by hitting the S button. And I hope that makes sense. So that is suppuration. When you bring these charts forward for a phase 1 evaluation or hygiene appointments, make sure that you're taking the suppuration marks off if suppuration is not present, okay? If it is present, leave it on there. It's very important information for us to know. Another thing that we will look at is the furcation. That is the area in between the roots of the maxillary and mandibular molars. They have multiple roots, so they split like this. And sometimes there is bone loss in between those roots. So we are measuring the space of that, or the amount of that bone loss. That is measured by this line, which is called furcation. So you can select those boxes, and it can be class 1, 2, or 3. Sometimes we skip around and tell you which teeth because they don't all have furcations. So we'll say the buccal of number 3 has a class 1 furcation. The mesial palatal of number 14 has a furcation, class 1. So you just need to follow along when we're choosing those furcational areas. And the last thing that we would chart is mobility. Mobility is found right here, and you will notice for the maxillary arch, there is only one line for mobility, and in the mandibular arch, there's only one line for mobility, because regardless if you're measuring the mobility from the buccal or the lingual side of the tooth is only, there's only one tooth there. Let's see, how do I say that? You can't measure mobility. It's the same whether you're doing it from the buccal or the lingual. The tooth is still mobile regardless of which way you're testing it from. So the tooth can only be classified one way, or it can be only classified one time is what I should say. So mobility is either 0, 1, 2, or 3. A class 3 mobile tooth is one that is very, very mobile and actually goes up and down in the jaw. So you will know that's an area that has pretty significant periodontal disease. Other things I should probably show you. Let me see right here. We talked about, okay, this is another good example. You can see right here on this patient, she has good attached gingiva. She has a little bit of recession, which in our periodontal charting is called gingival margin. So you would measure gingival margin of maybe starting with this tooth number, what is that, 21? 0, 2, 0, 0, 0, 0, 0, 0, 0, 0, 1, 0, 0, 4, 0, 0, 1, 0, 0, 0, 0. So that measures the actual recession on this patient. The second information we are charting is the attached gingiva. So you can see this band of attached gingiva right here is pretty good. So these areas have like 3, 3, and 3, 3, 3, and 3, 3, 3, and 3, 3, I don't know, 2, 3, 3, 0, 0, 3, 1, 3, and 3, 3, and 3. So that's how you'd actually measure the amount of attached gingiva or good quality tissue around that recession site. So that's important to note before and after gum grafting. Those are the areas that we would actually chart and measure. Sometimes you can have negative recession, and you will see this right here. This is negative recession, a patient who has excess gum tissue that we are measuring. So you will have a ton of attached gingiva. Do you see how there's a bunch of bound down attached gingiva there? It's that really dense fibrous looking tissue. You have a little too much, which is why it's negative. It should sit right at the CEJ, which is where the crown of the tooth meets the root, and this goes above and beyond the CEJ. So instead of having recession, which is gum tissue loss, we have an excess of recession, which we call negative recession. You chart it on the periodontal chart by hitting the negative and then putting the number. One thing that we have learned with Macpractice is make sure to chart your attached gingiva first before charting negative recession. Unfortunately, there are a couple of errors in the periodontal charting, and one of them is that if you measure negative recession and then go back and measure attached gingiva, it will delete all of your negative recessions. It does not do that when you have regular recession. Another couple of tips and tricks, and you probably already saw me struggle a little bit. If you jump around on the periodontal charting by clicking in different boxes, Macpractice has a mind of its own. It doesn't always go in this nice, sweet order that you're seeing it do right now. It will jump around. So if that happens and you skip from one area to another area, make sure for the first 3 probing depths, like 3, I'm going to hit 3. I'm going to click this 2 button over here. You see how it jumped back to that first box? You got to click on the second box. You got to click on the third box, put that third periodontal probing depth, click on the 4th box. And once you've clicked on the 4th one, you are good to go. It is just the first 3 boxes that give you the problem when you're charting. And every new employee has an issue with that, or people who don't probe very often will see that. If you skip around on the periodontal chart in Macpractice, make sure to click each of the first 4 boxes before it goes smooth and runs by itself. We are working with Macpractice to resolve this issue, and this is just a part of our life right now with the periodontal charting that has been an issue since 2015. So maybe even before that, but that's when we first started noticing it. So I hope this information is a little bit more informative, and I hope that it helps everybody in the back when they are setting up their periodontal chart. I hope it helps when you understand what we're actually looking for, both before as well as the healing phase, the phase 2 evaluations, and I hope it helps with people who are filing insurance claims to help prevent rejections. Y'all let me know if you have any questions.